Hello.
Hi. How you doing, Ingrid?
Can you hear me?
Yes, we can, and we can see you too.
Hey.
Great. Yeah. Great. Wonderful.
All right.
How are you
Well,
doing?
good. How are you?
Great.
All right. Let's get started with our first injury. It's Calvin Johnson. He had a shoulder injury. His coach said he wouldn't have gone back into the game had the game gone any farther. He's listed as day-to-day. Were you able to find anything more on this than shoulder injury? I know that's pretty general.
Yeah, so I found one report stating that he had a suspected AC joint injury, also known as a separated shoulder. And again, we've discussed these earlier. They're graded from 1 to 5, 1 being just a little bit of injury to the joint capsule, and 5 being a big dislocation or separation where you have like a deformed bump on the top of your shoulder. He says that he can't really raise his arm past shoulder level, so he can raise it about that much, and then he can't raise it above his shoulder because of pain. So I'm assuming he has probably a low grade, maybe grade 1 or grade 2 injury of his AC joint, and he might be able to play Sunday. Or if the injury is worse than that, he might be out up to 2 to 3 weeks.
Okay, so is this one of those situations where they can just inject some cortisone, say screw the guy's liver, and get him in the game?
If something is torn in there, I don't think cortisone really helps. But it could help with pain, I suppose. But I don't think it will help with healing.
Wait, I have been led to believe that cortisone helps everything.
Yeah.
That if you have any type of injury, you just take a shot of it and you're fine. That's not true?
Well, steroids always help. You're right. Steroids help everybody feel a little bit better. But they're given for inflammation. And so if he did have an injury there, he could have some acute inflammation that steroid injection would help short term, but it wouldn't help it heal long term. So if you want a quick fix and want to get him back on the field playing, sure, shoot him up.
I like the way you're thinking,
Wow.
Doctor.
Steroids. That's such a dirty word, Ingrid. Please, just use something else.
Our second guy is Aaron Rodgers, quarterback with Green Bay. He's got a concussion. He's listed as day-to-day. It's sounding more and more like he'll play. Should we be concerned if we're an Aaron Rodgers owner?
I think that's right. I think he probably will play. So he sat Wednesday practice out, and then he was back practicing a little bit on Thursday. Now, remember that the NFL guidelines that were revised in 2009 regarding concussion requires a player to be totally asymptomatic and back to baseline. And it also requires that he have a neurological exam by a non-team doctor or non-team health practitioner, so somebody who's not biased. Depending on the status of his exam on Saturday, he may be back to playing on Sunday. And given that he was playing on Thursday and practicing, I think that's a good sign.
Great.
Ingrid, I just want to tell you that I have Aaron Rodgers, so I'm commanding you to examine him and get his ass on the field
Cortisone.
Sunday.
Cortisone.
Shoot him
Cortisone
up,
right
dope
into
him
the
up,
temple.
Right to
steroids,
the
whatever you
head.
want
Take
to
care
call
of
it,
it.
make it happen.
Yeah.
Thanks, Berger.
It can't hurt. It can never.
Thank you.
Next, there was a terrible thing in Green Bay this week for tight ends, apparently. Jermichael Finley has got a torn meniscus. He's out 3 to 6 weeks. He had surgery on Tuesday. 3 to 6 weeks. Is there any way to narrow that down for us?
Yeah, I think the latest reports actually have him out for 6 to 10 weeks. So he tore the lateral meniscus of his right knee, and just as a review, the menisci are little C-shaped structures that are in the knee, and they cushion the knee and help absorb shock and weight bearing, and oftentimes they're twisted or torn by a direct blow to the knee or maybe chronic overuse. When they're badly torn, surgeons sometimes used to take the meniscus out, doing a meniscectomy, where they actually take the whole meniscus out. And they really try to avoid doing that in professional athletes, because if you take that cushion out, then the bone's rubbing on the bone and they get accelerated arthritis in that joint. So as I understand his surgery, they just went in and repaired the meniscus, sewed it back up, and hopefully, that will heal up. But again, I think that 3 to 6 weeks is overly optimistic. I think it's probably going to be more like 6 to 10 weeks.
So he might even be out for the year. Breaking news, by the way. I just heard Claire say that happened to her. Did you have a meniscectomy?
I had both.
I
had a meniscectomy, and then I was on crutches for 5 weeks, and then I had it taken out.
The important question here, though, is did your team win the game that day?
But you can still bear children, right?
Yeah.
I just
Out of my
Our viewers want to know.
I heard ectomy. I'm hearing steroids. I mean, you guys with the
She can
impotence.
still bear
I mean,
children,
it's
but
ridiculous.
she's furiously angry.
There's like steroids, impotence.
10 weeks it says now. Maybe.
Wow, 10 weeks. So he might be out for the rest of the year then.
Yeah.
All right, so now I actually just saw my typo. I'm sure you figured this out. It's not Josheth's addai, it's Joseph addai. But you probably knew that. He's got a neck, shoulder injury. That's all I can find on it. You're much better at it than I am. What can we expect from addai?
Yeah, I didn't find many more details on this injury. I'm not really sure. But, it doesn't seem like it's very serious. He probably has a bruise or a strained muscle in that area, maybe to the trapezius or anterior scalene muscle. Certainly if he had something like a rotator cuff injury, an AC joint separation, or a cervical spine injury, we would have heard by now, I assume, and they would have been taking those much more seriously. He himself is downplaying the injury, so I think given all of this, he's likely to be back playing on Sunday. It's probably just a little bruise or strain.
All right, good. So addai can suck it up. Now, there's some I didn't give you that I'd like to ask you about.
Sure.
Because Jermichael Finley's backup, Donald Lee, came in and played great for about 2 minutes, and then he was out. He's got a chest sprain. They're saying out about 3 weeks. Chest sprain. What does that even mean? How do you sprain a chest?
That's a terribly vague term. I don't know what that means. But if I had to guess, it might mean that he strained an intercostal muscle maybe in the chest, or maybe he even has a hairline fracture of a rib or a cartilage fracture of a rib like we talked about a couple weeks ago, I think. So, chest sprain, who knows what it could be, but it doesn't sound very serious. 3 weeks, that sounds probably like the outer limit that he would be out for that kind of injury.
So Donald Lee,
again, maybe they can give him some steroids and he could be back to playing.
Cortisone shot.
Dope him up. Do it.
And then that's really all that we got.
I
So
think
do you
we
have
should
one?
ask about Brett Favre.
Oh, Brett Favre. I mean, apparently the ankle's still giving him problems.
But the elbow, what is it? They say it's
Is it the elbow now?
Tendinitis.
Tendinitis, but
How does he position the
tendinitis.
camera phone to text with that tendonitis?
now what is that elbow injury? They say I've heard random different things that you just basically can't use your arm for 3 months for it to heal. Is there any?
So
Can I give him some cortisone?
Tendinitis? Is
Yeah.
that right?
Yeah.
Tendinitis.
Okay, yeah, and it might be. It's inflammation of the tendon, either of the lateral or the medial tendon. You've probably heard of tennis elbow. This could be similar to that, and it's, again, from repetitive overuse of that joint, which he certainly is at risk for. And so tendinitis is inflammation of the tendinous insertion of that muscle, probably the brachioradialis muscle in the elbow. And depending on whether or not it's just inflamed or whether or not it's partially torn, which it could be, he could be out for several weeks.
So you're saying cortisone shot?
Stop could work. Yeah.
Meniscectomy.
I mean, he also might have a bursitis where the cushions of the joint are inflamed, and cortisone can work for that as well. So.
Great. So what we're saying is get cortisone because it's awesome.
Yeah, it's awesome.
Yeah, our new sponsor.
Looking for
cortisone.
It's only a temporary fix.
All right, Ingrid, thank you again so much for getting all this for us. She's so much better at finding what these actual injuries are than I am. It's amazing. Thank you.
Thank you.
Bye. Thanks,
Good
Ingrid.
luck.
All right,
Bye,
bye-bye.
Ingrid.